survey of over 1,300 doctors from the Royal New Zealand College of GPs paints a worrying picture. Around 34% of GPs, general practitioners, plan to retire in the next 5 years. 17% already at or past retirement age. More than half of all GPs and over a quarter of rural hospital doctors have reduced their working hours in the last year. And on top of that, 18% of GPs and more than 25% of doctors, especially rural doctors, are considering leaving the country. Royal New Zealand College of GPs President Dr. Luke Bradford says doctors feel unrecognised and overworked. And he joins me now. Luke, good morning.
Morning, Leah. How are you doing?
Well, I'm good. Not good stats for you, though, I see. And we'll go through a bit of it, Luke. But I want to say, when you say unrecognised, I gather you mean by the government?
I think probably society as well. I think there's probably a misconception that if a GP's not in their office seeing a patient, they're not doing anything. So that whole 15-minute model seeing patients thing does cause some issues. We know that actually about 40% of the workload is outside of those appointments.
Okay, we'll get to that because that's interesting. Because I thought maybe it's the government, but they've boosted funded for GPs. In fact, I think you and I spoke about this when it was announced. An extra 285 million over 3 years, plus a further 175 million for 25-26. They say it's the largest investment in primary care in years. Also, the new medical school coming in Hamilton. I mean, these are all good things, Luke. Is that enough?
Oh, but definitely positive, and we have, without doubt, seen this year steps that have just not occurred in too long. As a result, the profession sort of got worn down. The last time we did this survey, we had almost 50% of members reporting being burnt out, severely burnt out. That's down by 20% this time. We've known about the retirement intentions for ages, but the problem we've had is recruiting new GPs into the training scheme, getting them through. So the medical school will help, the funding the 3-year training so that those doctors don't have to pay to train, which is what they were doing until announced last week, will help. Exposing people to general practice in their junior years, which is increased, another one of the announcements, will help. What we haven't yet got is the bit that attracts people to the job in the first place in terms of the time commitment, the level of work and the recognition.
Okay, so, I mean, and all the things that you mentioned, I suppose the other issue too is, Rome wasn't built in a day, so we are still looking down quite a few years before these implementations will be felt, correct?
Yeah, agreed. Yeah, it takes a long time to train a GP fully. There's a huge level of expertise in that. So, yeah, we've been calling for a long, long time to start turning the ship around. Hopefully that will start to occur now.
What about, we've spoken about this issue before, Luke, with GPs. So I suppose you weren't surprised by how many GPs say they're planning to retire. I think I was a bit shocked that we've already got 17% at or past retirement age.
Yeah, and I think that speaks to the dedication that a lot of doctors hold towards their patients and wanting to stay on and until someone's ready to take over. We've known this retirement wave is coming for a long time. If you look back over the last 10 years, we've been saying in 15 years, in 10 years, in 5 years. So there's a third saying they're going to go within the next 5 years. And these are people who are at or over retirement age. And so we've been pressing to change the model, to bring in other members of the clinical team to share the load, but also to just increase the juniors, and that's what we're pushing hardest for now.
So having said that we've got doctors that are pushing past retirement, then why have more than half of GPs reduced their working hours in the past year? What's behind that?
Yeah, look, some of those will be the more esteemed and more mature doctors. To be fair, overall, the reported average working hours has gone up by over 2 hours across members. So while some have reduced, many, many more have increased.
Okay. What's pushing rural doctors, hospital doctors, in particular, to consider walking away?
Their staffing numbers aren't as they should be in terms of getting them in, and it's an incredibly interesting, rewarding job, but it's very isolated. You're working for your communities, often a long way away from support services. long hours, and they're not necessarily seeing the support come into increasing their numbers underneath.
Okay. I suppose I had a bit of rose-tinted glasses on. I always thought that I would love to be in a rural, as a rural doctor. I thought it might be quite a good lifestyle, but you're saying it's could be quite the opposite.
No, I think there's huge rewards in it. You're very much part of your community. You know your people. You're able to contribute fully. But I think that you've got to also recognise you may be the only doctor for a long way, or one or two of you. That's a lot of time on call for the emergencies, for any out of hospital emergency situation comes through to you. So there is quite a lot of issues with that. So we do have to, the funding announcement made on Friday to reweight capitation to recognise rurality will make a difference, because we hope it will be able to attract more people out there.
There's a two-part question in this one, because you did mention you've been critical of the 15-minute appointment model. And then you mentioned paperwork, because I see that the stat of about nearly 40% of the GP's time was going into paperwork. So is this? So tell us about that. So the 15 minutes, you don't like that idea?
I think that 15 minutes is fine for a good number of patients, but it has always been the only option.
Yeah.
What we now have is GPs managing more and more complexity, more and more diseases, people living longer, and people not being able to access hospital and specialist services, and so being looked after in their communities. But also the cost of seeing us has gone up, in a lot of places, $70+. And so people can't just come in with one problem they feel and get it managed in 15 minutes. Well, this is it.
Yeah,
this is it. And so how do we actually look after patients properly when there's this sort of pressure to be able to do it all in 15 minutes, which of course doesn't happen. And what happens instead is people work through lunchtimes and breaks and late into the evenings and feel like they're not on top. They're always chasing their tails, and that leads to the burnout. So a lot of what we're calling for is an ability to have flexibility in how we design a model, so that those patients with higher needs are funded better, so that we can give them the time they deserve.
Okay, well, that's interesting. So if that was to happen, I see, because the capita ratio, obviously, that's how that you get funded. Would that mean, say I had to have longer and be with my doctor for half an hour, then the medical centre or my doctor, her funding theoretically should go up?
Yeah, and of course, it's how do you do that across the whole population? So
well,
there has been something on capitation reweighting where we're moving away from just basing it on your gender or your age up to 65, and acknowledging that people are living a lot longer than 65, acknowledging that people with lots of conditions, comorbidities we call it, that they need more care and more frequent care or longer care, so increased funding to them, increase for rural, increase for deprivation, so that we know people from areas of high-risk socioeconomic need often require a lot more time and effort from their health perspective. What has been missing from that reweighting announcement by the government is ethnicity. We know it's a standalone factor for poor health outcomes for Māori and Pacifica, but that was not included this time in the reweighting considerations, which will come in next year. So we're hoping again that from next year we'll start to see some changes.
Because that's always a bit of a thorny issue there, Luke, because this government has said we will not prioritise certain ethnicities over others because we all need to see the doctor. So are you expecting something to come out that says Māori and Pacifica may get, longer times with the doctor, or?